Hi everyone, and welcome to another episode of Cybersecurity Sauna. Thanks for joining us for another session where we sweat out the hot topics in security. So welcome to all our listeners, and be sure to follow us on Twitter at #CyberSound. Contact tracing is a key strategy for preventing the spread of COVID-19, and smartphone-assisted contact tracing automates a laborious process. But contact tracing technologies face criticism from privacy advocates concerned about potential for abuse. F-Secure's privacy expert Tomi Tuominen argues that the issue is a process problem, not a technology problem. Today we're talking to Tomi about contact tracing and how apps that are respectful of privacy should work. Welcome to the show, T.
Thanks.
First of all, there's different kinds of contact tracing apps out there. The way they work and how they store user data can differ a lot and affects the impact on privacy. So let's start by breaking down these main differences. Can you explain the concept of location-based versus proximity-based?
First of all the apps that are considered to be true contact tracing apps are not based on location.
Right.
And the reason is location-based, meaning GPS and Wi-Fi based detection or location tracking doesn't really work for this use case. These contact tracing concepts could be roughly categorized in three different buckets. First one being centralized, which is an initiative called PAPPPT. Sounds horrible, right? Pan-European Privacy Preserving Proximity Tracing. There, the idea is that there is a centralized repository where you collect all these beacon data or tracing data. Then you have a strongly distributed system. It's called DB3T, Decentralized Privacy Preserving Proximity Tracing, where the idea is that basically the only place that has the information, whether you have been in contact with somebody who has, in this case, COVID, your device is the only place where that information is stored. And then you have this Apple, Google contact tracing project, which is essentially a bag full of Legos. So it offers you tools that could be basically used for distributed models. So in reality, most probably the solutions that we're going to see will be utilizing mostly the distributed model, but there has to be some sort of centralized element as well, because the needs of healthcare professionals differ from the needs of individuals.
Yeah, okay. So talking about those different approaches into contact tracing, what's the sort of consensus like? How does this work?
There seems to be a pretty common understanding or approach to this. So the idea is that we're going to be using some sort of radio transmission to measure if two people are close enough to each other. So in this case, most probably that technology will be Bluetooth beacons. And the idea is that if I meet you and we are, let's say, within 3 meters of each other for maybe 10, 15 minutes, then both of our devices will record that one-time token that we actually met. And that token is randomized. So the next guy I'm going to be meeting with most probably is going to have a different token. So it's something called privacy preserving token. And at that point, it's only stored locally on your device. So at that point, nobody else gets it. If later on there is a need that either I get infected or you get infected, then the story changes. So then there has to be a mechanism that allows us to tell each other that either one of us been infected. And of course, in that case, the message has to go both ways, because I have to be able to inform you and you have to be able to inform me. So that's also where the centralized storage comes into the picture, because you need to have a register how you can actually connect those randomized tokens to real human beings.
To connect them to what exactly? Are we talking about contact information? Am I going to get a phone call, or just connect them to my individual app through some unique identifier and I'll get an alert in the app?
That's a very, very good question. And this is basically what I mean when I said originally that this is a process problem. Yes, you need technology to solve this, but essentially, like, let's play this game for a second that I've been infected. I go to the local healthcare provider and they test me. And when I'm positive, there has to be a way how that healthcare provider can inform those people who've been in close proximity within the past 14 days, which is the time that those tokens get stored. But at that point, they only know my identity, and that's what I meant that by saying that this is a process problem. That the tokens used can be as randomized and as privacy preserving as just possible, but there has to be a way how the healthcare professionals can be in touch with real human beings. So that remains to be seen. Most probably that's going to be solved on a national level, and it's going to be more of a reflection of the current governmental model in each and every specific country, an application level problem.
Yeah, and I guess we can't necessarily count on your cooperation in that situation. Like, not everybody wants to alert everyone else that they've been diagnosed positive.
That's a very, very good question. So, at least in Finland, there seems to be a very, very strong consensus that this will always be on an opt-in basis. And I think that it will be a blessing and a curse at the same time. Yes, we get to keep our rights, but at the same time, unless we get enough people to use this application, it's gonna be pretty much useless.
But isn't there like a give and take? Like, you can opt in, like you can choose whether or not to install this app. But once you do, like, these are the sort of the rules. This is the cost of, being able to get the alerts. The cost of that is, having to give them out as well.
I find this whole discussion pretty funny. At the same time, people are posting whatever to Facebook, Instagram, LinkedIn, Snapchat, TikTok, whatever, depending on your age. And now people are like, yeah, I'm not going to be installing that application. Like, this is most probably going to be the most scrutinized, most researched application ever on the planet. And there also seems to be a very solid common ground there that this has to be open source, meaning that all the people who just have the skills can actually look at the source code and see how it works. Also, one thing worth noting is that Apple and Google did, in my books, I think they did something really, really sensible. So they have said from the beginning that each country can have a single application on their app store that will have these special rights. And even then, it's going to be opt-in. This is actually a very, very smart move, because essentially it means that there is going to be only one official application per country, which means that it's going to be easier to vet these applications and see that they actually do what they are promising to do.
Fair enough. So, are there any other principles that are being tossed around in the discussion that you would definitely want to see in any sort of real and responsible contact tracing app?
Well, essentially, this is some sort of like limited surveillance, right? So, first of all, it has to be lawful, has to be necessary, and proportionate. So, in this case, I personally interpret that there is this pandemic that we're trying to tackle, and that's the use case for this. I'm not a big fan. Like, currently, Estonia and a few other countries, they are playing with this idea that this would basically be a sort of a hive mind type of system where you can alert the public transportation agencies and whatnot on this. I'm strongly against that, because this is a difficult problem to solve, even in this limited use case. And if you add more players to the picture, it's going to be extremely complicated. And also that like all sort of extensions to this monitoring and surveillance, they need to have some sort of sunset clauses. Like this is a limited time period where you can do this. I'm not a fan of giving this right from here to eternity to these players, and this is not a mistrust. Like it's a different thing. I just think that it has to be limited somehow, that there is a beginning and there is an end. Otherwise, we're going to end up in a situation where we give out our basic rights until the sun dies down.
Right. But like, for example, we're now talking about a system that will store my data for 14 days, and I can, it's on my phone, so I can install it and uninstall it whenever I want. So isn't that enough of a sunset? 14 days after I uninstall it, my data's gone.
Actually, once you uninstall, it's gone immediately.
Okay. Even better, yeah.
So it's even better that 14 days is the maximum amount of time that your device will store it, assuming that the model is distributed one.
So that would be good enough for you?
I personally, I think that we have way bigger risks than this application.
Absolutely.
I mean, this is, if you look at the big picture, I'm a pragmatic guy, so I think that even having an application on your phone that checks the local weather, there has been cases like that the weather providers have been selling that location data to third parties, and that's not something that you would expect from your weather application on your phone. So, and that's the thing. First of all, I personally think that Apple and Google are exactly the right players to do this, because those guys know how to do it properly. They have the proper resources to do that. And also on a more pragmatic standpoint, those guys pretty much share the market when it comes to smartphones or other like phone-like devices. And if we are expecting this thing to ever work, this is the cooperation that is needed. And they've been very, very transparent and open about it. And like I said earlier, the national solutions will most probably be open sourced. And I think that actually gives the transparency, or offers the transparency that we need for these kind of use cases. I'm not really worried about this. The exposure API or the tracing APIs that currently are in the works, they basically just tell that, okay, these two devices were within 3-meter radius for 10 minutes or 15 minutes, and on that specific day. That's the only information that gets stored. Of course, you can most probably enhance this or enrich this data, but that's it in a nutshell, that it gets stored. And I think that we usually share much more than that about our private lives. And that's the reason why I'm not that worried. Also, one thing that is worth noting is that unless you or somebody in your contact circles gets infected, that data will never be transmitted anywhere.
Okay, so let's talk about the whole concept of contact as it relates to these applications. So, like, for example, how far does Bluetooth penetrate, and would we be using that whole range, or sort of limiting it that, like, within the 10 meters that Bluetooth penetrates through structures, we're only thinking about the first 3 meters?
Assuming I've understood it correctly, they are basically measuring the amount of energy that the Bluetooth chip draws.
Right.
So they are capping that. And unless you have an external antenna, it's kind of well understood how long the Bluetooth signal will carry. Of course, it gets impacted by like walls and metal structures and whatnot. But I guess you can get some sensible averages from there. And as far as I understood, this is something that Singapore did already 10 years ago. They started making these like normalized measurements that how different Bluetooth chips operate. And they were able to build this baseline that they gave out for free. so that people know that, okay, if my Bluetooth chip is drawing this amount of energy or voltage, it means that this other person was within 2 meters or 3 meters. And that's, of course, super, super valuable in this case. So I think that on average, that data will be reasonably trustworthy. I mean, the question I hear people asking is that, okay, if I'm sitting on a room next to this guy, like, will the system still mark as
like with a wall between us?
Yeah, exactly.
Or in the next car over.
Yeah. So the short answer is that yes, we're going to have some false positives.
Mm-hmm.
But at least when you get to see the date, you know if you've been in touch with anybody on that day, or if you were just sitting on your car. So, and this, of course, brings us to this question that, okay, if I know this is a false positive, as an individual, do I have a chance to send that information upstream? Like, is there somebody I can notify? But I guess in the bigger picture, those are going to be outliers. We're going to be pretty well off in that regard. I'm not too worried about that.
But let's talk about the kind of information being shared. What do you think the level of detail would be? Like, I was in contact with a sick person on Tuesday, or I was in contact with a sick person at 9:30 on a Tuesday.
Most probably there's going to be national differences on this one.
Mm-hmm.
The Apple Google API, as far as I know, is only sharing the date.
Okay.
And that's it.
So you can't get more granular than that, even if you want to.
No, this is a good question. As a healthcare professional, it might be very, very beneficial. And there is most probably going to be some sort of discussion that's going to happen that, okay, this is what we get, but this is not what we need. And depending on who you ask, you're going to get a different answer.
Yeah, but like if everyone's limiting their contacts, then the number of people you come into contact with within a day should be fairly limited in the first place.
Well, yeah, and then there are exceptions. I mean, if you're in a bus or tram or like underground or whatever, then of course it's a very, very different ball game.
Yeah. You were already talking about some of the different governments and regions taking their approaches into this. Are we seeing a difference? Because certain nations have more of a privacy approach than maybe some of the other ones. So are we seeing a division between those lines? Are the more privacy-oriented nations taking better steps? Or
many of the nations have already now changed their opinions, Germany being a prime example of that. Originally they were like, yeah, we're going to build this ourselves. And then when Apple and Google came out with their solution, they completely changed their opinion. Originally, Germany was planning on doing a centralized solution. And then when the Apple-Google coalition came out, they said that, okay, this distributed model actually looks better. And they went for that. This seems to be very, very political decision in many ways. And it doesn't seem to follow EU borders or even continents. So different places have solved this very, very differently.
Is there anywhere where you particularly like the approach that they've taken?
In this case, the devil is always in the details. Nobody has a fully working solution yet. There are some very, very good initiatives around this. In Finland, we're piloting it currently. It really depends how the whole chain is actually implemented, like how the healthcare professionals are activating the notifications, who does the testing, who's authorized to notify people, and so on. There are so many things that could go wrong. So the application can be top notch. The whole ecosystem can be just pure gold. But if the healthcare professionals are then doing something completely different than expected, it's going to ruin the fun for everybody. I'm not expecting that to happen, but all I'm saying is that currently I think everybody's doing things that they think are the right ones. I mean, just if you look at Sweden, they have had a completely different approach to this whole COVID thing as opposed to Finland, for example. And nobody knows if their approach has been better. After a few years, we're gonna see if their approach was a good move or not. Now everybody's just looking at the statistics and this is horrible and this is good and so on. But we're gonna see after a few years which approach was the best one.
Yeah, absolutely. Getting back to the apps themselves, research are saying that we'd need a coverage of about 60% of the population installing one of these apps to get like actual effective results. Is there a value in these apps even if we don't get up to that number?
That's a very good question. That's actually one of the things I've been mostly worried about because this is simple math. I mean, if you have more people using the apps, the more beneficial it will be. And
for everyone.
Exactly. And I'm actually quite worried that we're investing huge amounts of time and money to do this, and then nobody's ever going to use it. So I think this is, at the end of the day, it's not a binary operation. I mean, even if you have few people that are using the app, most probably it's better than having 0 people using the app. But that's a real threat to this project, I think.
What about the human side of this? Is there anything we can do in the app to help take care of the people when they get the notification that they've been near someone with the symptoms? Like, for example, there was a woman in, I think the UK was disappointed that she got notified that she'd been near somebody with COVID-19, but it only gave her like general advice, like, wash your hands and stuff like that. And she was like, well, I'm already like exposed. Like, what should I do now?
That's going to be most probably very, very nation specific. So what's important to know that even not the latest iOS 13.5 that comes with the contact tracing API built in, it's an opt-in. You have to enable it. And for example, for Finland, it doesn't even work. You cannot enable it at the moment. But even with that, it's just bag of Legos. Like it offers you building blocks, and the national application needs to decide how and what will be done. Like there has to be a process built around it. The application itself most probably will be very, very simple with a very, very simple UI, but the process around it will differ significantly.
So maybe the app will just like guide you to an external resource that you then go to and get more information.
Or, I mean, the whole contact tracing thing is just one piece in the puzzle. So some other countries are doing a lot more testing than others. Some are using masks extensively. Some other countries are doing more self-isolation than others. So it really depends. You have to have a holistic view to this, where the application is just one part of the equation. And I think that the instructions will also reflect the state of general medical healthcare system that you have. So yeah, your mileage may vary.
Yep. So as a hacker, you're always thinking about how to break things and how to abuse things. What sort of abuse scenarios do you see for a contact tracing app? Like what are people going to do to abuse this app?
Like already discussed, there's going to be significant differences depending on which country you are in. But I'm not really that worried about the traditional vulnerabilities or exploits targeting these things, because they are going to be extremely well scrutinized. Most probably one of the most safe and secure applications on the planet, to be honest. But I am worried about the possible privacy impact, and especially the process built around it. Like, what if a governmental official abuses the power that they can, for example, the healthcare providers can mark a specific person that they've been infected and then use that information somehow. I think that there has to be safeguards against this type of abuse. And as a citizen, I need to be able to inform the governmental body that I think that my rights have been violated, and there has to be somebody there who's able to process that complaint. This is the same thing with all the controls that are somehow impacting our privacy or our basic rights. That if there is like governmental censorship or any sort of thing, there has to be a process around it where people can report possible abuse. It doesn't have to be automated. I mean, I'm actually a bit against the fact that there would be a box on the application that you could just take that I think I've been abused or my data has been abused. But I think there has to be some sort of process to make sure that if there is an abuse of rights or abuse of power, there has to be a way to report that.
Makes sense. So I guess the final question is, would you install an app like this? Well, like the one we're developing in Finland?
Actually, I would, because I think that we are fighting a global pandemic, and any solution that will help us as a society or as a country is worth trying for. Well, maybe not everything, but I think we have a reasonably solid foundation for this, and I think that even if it just helps us a bit, it's worth it.
Well, on that note, I want to thank you for being with us today and helping us make sense of the contact tracing app situation. Thanks, Tomi.
Thanks. It was a pleasure.
That was our show for today. I hope you enjoyed it. Make sure you subscribe to the podcast, and you can reach us with questions and comments on Twitter through F-Secure with the hashtag Cybersauna. Thanks for listening.